I've been doing this job for almost 6 years now, and when I started, our pharmaceutical companies had maybe 1 or 2 targeted therapeutics in the pipeline. Now, almost all of their drugs start with a biomarker strategy. I think there will be great advancements in personalized medicine very soon, and this is a great example of it. The first advancement is just knowledge of what personalized medicine is. 2 is taking advantage of it. So I think we've seen an evolution in our personal ownership of healthcare. I'm sure you all remember when WebMD came online. It was the first time that people could go to the computer and get information on symptoms. If you received a diagnosis from your doctor, you could then go online and find out more information about that diagnosis. Consumer genomics and having access to our own genetic information is an evolution of that ownership of our own personal health care. I think another advancement is just in patience with trial and error medicine. So in the future, I think we're going to have more experiences where our doctor gives us a test first before prescribing a therapeutic. And that's really exciting. Again, it cuts out trial and error medicine and it gets to what ails you sooner. And in some really scary areas like cancer, I think we need to get to that right drug the first time. As we get more evidence about the utility of consumer genomics or genetic information, we're going to see health insurance plans and our employers make that information available to us, because we've seen some evidence that it does change our ways. So for example, if somebody gets genetic information indicating they have more of a chance of having diabetes, they're very likely to eat right and exercise and make those lifestyle changes to avoid diabetes. Another great evolution in personalized medicine that I think we're going to see is cancer tumor typing. What does that mean? When you're diagnosed with cancer and it's a solid tumor, right now you could have that cancer tumor typed, which means you can find out all of the genetic information available for that tumor. We have some very innovative companies and also some very innovative academic medical centers who are doing this right now. Get diagnosed with cancer. They take a biopsy of your tumor, they genotype it, and then they match the genotyped information of that cancer to drug labels. In that way, they're getting the right drug to the right patient the first time. Right now, this is done once you've failed at first line, second line, third line treatment, but I think more and more it's going to be the first step in cancer care.